Measles, which are also called morbilli, is a highly infectious disease caused by the measles virus. The measles virus is one of the most transmissible microorganisms in the world. This virus is spread by droplet transmission, or airborne, and can be discharged and spread into the environment by an infected person through coughing or sneezing. The epithelial cells in the respiratory tract are the first target for measles virus, in addition to lymphoid cells. The cause of measles is a result of the exposure to the paramyxovirus, specifically the morbillivirus, and as said earlier, this virus can be delivered through breathing, sneezing, and coughing. Measles can be extremely serious. Just how serious can it get? I want you to guess. Which one of these facts do you think is true? 1 out of 4 people who get measles are hospitalised. 1 out of every 1,000 people with measles develop brain swelling, which can lead to brain damage. Or 1 or 2 people will die of measles, even with the best care. Well, in fact, it is a trick question. All of these facts are true. Measles can be a scary disease. Some of those who are treated can still die from it, which is why early detection and prevention of it are highly necessary. The symptoms of measles begin after the incubation period, which is usually between 1 to 3 weeks, and those symptoms include fever, cough, malaise, cold, and even an inflammation of the conjunctiva of the eye. Another common symptom is skin rash, which starts from the head and gradually spreads towards the trunk of the body and extremities a few days later. And before the full development of the disease, colic spots start becoming more visible as punctured blue-white spots on reddened areas such as the buccal mucosa of the cheeks. Before the introduction of the measles vaccination, measles has been the cause of millions of deaths worldwide each year. There was an approximate 0.2% of death cases caused by measles reported in the United States of America from 1985 through 1992. Approximately 30% of the measles cases that were reported had complication, and mainly among children aged 5 or younger and adults 20 years of age and older. Poor control of measles can lead to some serious results, such as pneumonia, encephalitis, and even death. Clinical recovery of measles starts soon after the appearance of skin rash in uncomplicated measles. However, the skin rash will fade after a few days in the similar order that it appeared. Prevention is the most expensive evidence-based approach to treating measles in both young children and adults, which includes vaccination as an effective way to ensure measles are not contracted or passed on to other individuals. This strategy of prevention by vaccination is suggested by companies such as UNICEF and the World Health Organization to reduce measles outbreaks around the world in hope of eliminating measles. The vaccination treatment is over 85% effective in that individuals will not contract measles, even when around others who have the infection. The cost of vaccination is usually covered by the government, which highly reduces the urgent hospitalization for people impacted by the virus. The least expensive evidence-based approach to treat measles is using vitamin A supplements when the virus is contracted. In the case of outbreak of measles, those who suffer vitamin A deficiency or lack vitamin A have higher mortality rates if measles is contracted opposed to those administered with vitamin A. Individuals who have contracted measles are recommended a specific dosage of vitamin A to help with recovery, as it boosts the amount of antibody production in the patients to fight the measles virus. Drinking large amounts of water is also highly recommended, in addition to other fluids, as warm drinks can help any coughing effects, and also taking paracetamol and vitamin A supplements as part of the treatment process. In my opinion, it is best for all individuals to vaccinate both themselves and their children or families against measles. The vaccination is a much safer method of treatment by prevention. It is also safer for the community if all people are vaccinated, so the likelihood of a measles outbreak to occur is rare, and not as many people would be affected. The small expense of vaccination saves costs, as if an individual was to get measles and were hospitalised, the cost would be a lot greater. Thank you for listening to this presentation. I hope now you can understand the measles virus and its effect on the human body. Having an understanding of its symptoms and how to treat it is necessary in making sure you and others stay healthy if there is any risk of exposure to the virus.